Assalamu alaikum wa rahmatullahi wa barakatuh. Today we're going to be talking about a disorder that is not entirely about medicine. We'll be talking about dental caries, and this is actually the preserve of a dentist. But we're going to do a little brief so that you would know why it is important for you to visit your dentist at least twice a year. Tooth decays are a destruction of the mouth, of a teeth actually, that is gradual and is very common and eventually may result in total destruction of a tooth structure. How does it occur? We all eat very sugary things. The mainstay of our diet is carbohydrates, and in the presence of carbohydrates and its broken down products, we have enough substances on which the microorganisms that are within the mouth can act on. And then if you have a tooth surface that is susceptible to these microorganisms, then you already have a mix for tooth decay to occur. Normally, the saliva in our mouth helps to keep the microorganism load within our mouth less than if the saliva was not to be there. But for tooth decay to occur, there would have been the formation of what we call a plaque, which is made up of the microorganisms, the food substrates that we talk about, already caked together by the cells, the mucosal cell lining of a mouth. And this plaque, being a tough substance, is not easily dislodged by the function of a saliva. Now, we are advised generally to wash our mouth in the morning, brush our teeth in the morning, brush our teeth in the evenings. Why we need to do that is to reduce the load of microorganisms in our mouth. Normally, there are some microorganisms whose habitat is the mouth. But if you brush regularly, you will reduce the load, and then they will not be able to interact with the food substrates that I mentioned earlier, and also not be able to form a plaque and not be able to destroy your tooth. Hence, the need for you to brush regularly. If you use a soft bristled toothbrush, then you are in order, because you'll be able to get to every corner of the mouth, and you must have a proper brushing technique to do this. The other thing that we can do to help us not to have tooth decay is also, if we are able to brush our teeth after every meal. If we do that once again, we'll be able to reduce the microorganism load. We'll also be able to prevent plaque formation. Once plaque has formed, no amount of saliva and not much can the brushing that we do to dislodge the plaque. We'll just have to visit our dentist to ensure that the plaque has been removed. Unfortunately, most people do not visit the dentist until the tooth decay has progressed. By this I mean that they notice, oh, there's a black coloration in my mouth, or there is so much pain that they can no longer bear it, or they become sensitive to cold drinks or hot drinks, whatever they eat, especially if it contains sugar. They feel so much pain. This is when they now think, oh, I should visit my dentist. Please note that, as with every other thing, prevention is always cheaper and better than cure. Whereas a decaying tooth can be arrested at whatever stage you present yourself to the dentist. Note that the one that has already decayed, that has already been destroyed, can no longer be regenerated. So you may actually end up losing your teeth. And as every dentist will say to you, you do not really want to lose any of your natural tooth. So keep on brushing, ensure your mouth is well taken care of, and visit your dentist at least twice a year. Assalamu alaikum wa rahmatullahi wa barakatuh.